Module 13, Long-Term Care Patient/Resident, Part 3. The purpose of this unit is to introduce the student to the basic structure of the body and to review the effect of aging on body structure and function. Common physical and psychological conditions found in elderly patients are presented along with approaches to care. Community resources commonly available to assist elderly patients with their psychological, recreational, and social needs are presented. Hello, CNA students. Let's be honest, Module 13 is a giant module with 290 vocabulary terms. In order to study and understand Module 13 effectively, we need to understand that the vocabulary terms are well organized into specific parts and systems. To help you, we now have broken down Module 13 into 4 distinctive parts. For Module 13, Part 3, we are studying the gastrointestinal system, the respiratory system, and the musculoskeletal system. 5. Gastrointestinal system, digestive system. What it is, the system that breaks down food and absorbs nutrients. Main function, digest food, absorbs nutrients, and removes solid waste from the body. Key parts. Mouth, where digestion begins. Esophagus tube that carries food to the stomach. Stomach breaks down food with acid. Small intestine absorbs most nutrients. Large intestine, colon, absorbs water and forms stool. Liver makes bile to help digest fats. Pancreas makes enzymes to help digestion. Important for CNAs. Monitor bowel movements. Frequency, consistency, color. Help with feeding and nutrition. Watch for nausea, vomiting, abdominal pain. Report changes in appetite or eating habits. 6. Respiratory system. What it is, the system that helps us breathe and get oxygen. Main function, brings oxygen into the body and removes carbon dioxide waste gas. Key parts. Nose and mouth, where air enters the body. Trachea, windpipe, carries air to the lungs. Bronchi tubes that branch into the lungs. Lungs, where oxygen and carbon dioxide are exchanged. Diaphragm muscle that helps with breathing. Important for CNAs. Count respirations, breathing rate. Watch for difficulty breathing, coughing, or chest pain. Help patients with breathing exercises. Keep airways clear. Help with coughing, positioning. 7. Musculoskeletal system. What it is, the bones, muscles, and joints that give the body structure and allow movement. Main function, supports the body, allows movement, and protects internal organs. Key parts. Bones give structure and protect organs. Muscles allow movement and maintain posture. Joints where bones meet and allow movement. Tendons connect muscles to bones. Ligaments connect bones to other bones. Cartilage cushions joints. Important for CNAs. Help with safe movement and transfers. Watch for signs of fractures, broken bones. Report joint pain, swelling, or limited movement. Help with range of motion exercises. Okay, now get ready to learn by pronouncing each of the following vocabulary terms, as well as listening to the sentences for each term in context. Are you ready? Okay, let's do this.
Module 13, Long-Term Care Patient Resident Part 3. The purpose of this unit is to introduce the student to the basic structure of the body and to review the effect of aging on body structure and function. Common physical and psychological conditions found in elderly patients are presented along with approaches to care. Community resources commonly available to assist elderly patients with their psychological, recreational, and social needs are presented. Performance standards objectives define key terminology. Gastrointestinal System. 144 Absorption. 145 Bile. 146 Bowel movement. 147 Colon. 148 Colostomy. 149 Constipation. 150 Defecation. 151 Diarrhea. 152 Digestion. 153 Diverticulitis. 154 Elimination. 155 Enema. 156 Fecal Impaction. 157 Feces. 158 Flatus. 159 Gastrectomy. 160 Gastric tube. 161 Hernia. 162 Ileostomy. 163 Nasogastric tube NG. 164 Obstruction. 165 Occult blood. 166 Ostomy. 167 Percutaneous endoscopic gastrostomy PEG. 168 Peristalsis. 169 Stoma. 170 Stool. 171 Suppository. 172 Ulcer. 173 Urgency. 174 Urostomy. Respiratory System. 175 Alveoli. 176 Asthma. 177 Bronchi. 178 Carbon dioxide 179. 181 dyspnea. 182 emphysema. 183 expiration. 184 inspiration. 185 larynx. 186 lungs. 187 mucus. 188 nasal cannula. 189 nebulizer. 190 orthopnea. 191 oxygen mask. 192 pharynx. 193 pneumonia. 194 sputum. 195 tracheostomy. 196 tuberculosis TB. 197 upper respiratory infection URI. Musculoskeletal system. 198 abduction. 19 adduction. 200 amputation. 201 arthritis. 202 atrophy. 203 bursitis. 204 contracture. 205 extension. 206 flexion. 207 fracture. 208 full weight bearing FWB. 209 gout. 210 muscle. 200 muscular dystrophy. And 212 osteoarthritis. 213 osteoporosis. 214 phantom pain. 215 pronation. 216 prosthesis. 217 range of motion ROM. 218 rheumatoid arthritis. 219 rotation. 220 skeleton. 221 supination. 222 total hip arthroplasty. 223 trapeze. 224 vertebrae. CNA California Exam Vocabulary Sentences for Module 13. Gastrointestinal System terms. Absorption is when digested nutrients enter the bloodstream. Bile helps break down fats during digestion. A bowel movement is the elimination of waste from the intestines. The colon is the large intestine that processes waste. A colostomy creates an opening in the abdomen for waste elimination. Constipation means having difficulty passing hard, dry stool. Defecation is the act of having a bowel movement. Diarrhea involves frequent loose, watery bowel movements. Digestion breaks down food so the body can use nutrients. Diverticulitis is inflammation in pouches that form in the colon wall. Elimination is the removal of waste products from the body. An enema involves putting fluid into the rectum to stimulate bowel movements. Fecal impaction occurs when hard stool becomes stuck in the rectum. Feces is solid waste eliminated from the body. Flatus is gas that passes through the digestive system. A gastrectomy is surgical removal of part or all of the stomach. A gastric tube is inserted into the stomach for feeding or drainage. A hernia occurs when an organ pushes through a weak spot in muscle. An ileostomy creates an opening from the small intestine to outside the body. A nasogastric tube, NG, goes through the nose into the stomach. An obstruction is a blockage that prevents normal flow. Occult blood in stool cannot be seen without special testing. An ostomy is any surgical opening from an internal organ to the outside. A percutaneous endoscopic gastrostomy PEG tube provides nutrition directly to the stomach. Paracelsus moves food through the digestive tract with muscle contractions. A stoma is the visible opening created during ostomy surgery. Stool is another word for feces or bowel movement. A suppository is medication inserted into the rectum or vagina. An ulcer is an open sore in the stomach or intestinal lining. Urgency means needing to have a bowel movement immediately. A urostomy diverts urine from the bladder to an opening in the abdomen. Respiratory system terms. Alveoli are tiny air sacs in the lungs where gas exchange occurs. Asthma causes airways to narrow, making breathing difficult. Bronchi are large airways that carry air into the lungs. Carbon dioxide is a waste gas that the lungs remove from the body. Chronic heart failure, CHF, can cause fluid to back up into the lungs. Chronic obstructive pulmonary disease, COPD, makes breathing progressively more difficult. Dyspnea is the medical term for shortness of breath. Emphysema damages the air sacs in the lungs. Expiration is breathing out or exhaling air from the lungs. Inspiration is breathing in or inhaling air into the lungs. The larynx contains the vocal cords and helps produce speech. The lungs are the main organs of breathing and gas exchange. Mucus is a sticky substance that traps dust and germs in airways. A nasal cannula delivers oxygen through small tubes in the nostrils. A nebulizer creates a fine mist of medication for inhalation. Orthopnea means breathing is easier when sitting or standing upright. An oxygen mask covers the nose and mouth to deliver concentrated oxygen. The pharynx is the throat area that connects the nose and mouth to airways. Pneumonia is an infection that inflames air sacs in the lungs. Sputum is mucus coughed up from the respiratory tract. A tracheostomy creates a breathing opening directly into the trachea. Tuberculosis (TB) is a serious lung infection that spreads through the air. An upper respiratory infection (URI) affects the nose, throat, and sinuses. Musculoskeletal system terms. Abduction moves a body part away from the center of the body. Adduction moves a body part toward the center of the body. Amputation is the surgical removal of a limb or body part. Arthritis causes joint inflammation, pain, and stiffness. Atrophy occurs when muscles shrink from lack of use. Bursitis is inflammation of fluid-filled sacs around joints. A contracture permanently shortens muscles and limits joint movement. Extension straightens a joint by increasing the angle between bones. Flexion bends a joint by decreasing the angle between bones. A fracture is a break in a bone. Full weight bearing FWB means a person can put their complete weight on both legs. Gout is a form of arthritis that causes sudden, severe joint pain. Muscle tissue contracts to create movement and maintain posture. Muscular dystrophy is a group of diseases that weaken muscles over time. Osteoarthritis causes joint cartilage to break down with age. Osteoporosis makes bones weak and more likely to break. Phantom pain is felt in a body part that has been amputated. Pronation turns the palm downward or inward. A prosthesis is an artificial replacement for a missing body part. Range of motion (ROM) exercises move joints through their full movement. Rheumatoid arthritis is an autoimmune disease that attacks joints. Rotation turns a body part around its central axis. The skeleton provides structure and protects internal organs. Supination turns the palm upward or outward. Total hip arthroplasty replaces a damaged hip joint with an artificial one. A trapeze bar helps residents move and reposition themselves in bed. Vertebrae are the individual bones that make up the spine.